At Matter, we've been committed to providing access to healthy food in our community since we started the organization 15 years ago. And we really believe that today our mission has never been more relevant. The combination of health and food is really something that a lot of people are focusing on today. And so our commitment to the food space has really evolved.
So what we found was that it's no longer enough to be able to just connect people with food. The more important issue is connecting with people with the right type of food. And so we worked with the dietitians at HCMC. We crafted 3 types of MATTERboxes filled with meals that are designed to not only feed people and fill them up, but also make sure that they're connected with healthy food and with education on how to eat right, how to shop healthy on a budget. It's HCMC themselves, they help us design this box, and they liked it so much, like, hey, can we use this? And so now they're using it in their diabetes education program.
We do 4 to 6 individual classes, at least 4 or 5 visits with the nurse, and then at least 2-3 visits with the dietitian. We just tell them in order for you to take your insulin, you gotta eat. And a lot of them are withholding their insulin because they don't have food in the house. So this really helped them a lot. So the class is really learning what to eat, how to eat, the timing of the food, and the portion size. So when they learn that, combined with their medication and increasing their activity, we actually see a lot of improvement.
The challenge is that a lot of these organizations haven't worked with food access in the past, primarily because of capacity issues. It requires a lot to do food distribution. But now, the box allows them to be able to do that in a really easy way, a way that reduces those capacity issues.
The deputies use the MATTERboxes in a variety of circumstances and encounters with the public. Could be walking a beat in downtown Minneapolis on Nicollet Mall. They come across someone who's a little less fortunate, maybe homeless. And so the deputies will provide them a box or 2 from Matter.
There's no news stories that says, hey, there's youth out there who are riding the bus all night long. And I talked with a couple bus drivers, and we talk about homeless youth, and they're like, yeah, I kind of know which ones are typically going to hang out a while if I do a whole entire route and they're still on the bus. He's like, I typically don't say anything. I let them ride for free, you know what I mean? And so it's kind of those little things that people are aware, but at the same time, it's still an issue. We've given a lot out to our homeless youth who are couch hopping or staying at their friend's house, and so it's sort of their way of kind of earning their keep.
So going forward, we are really going to focus on these new opportunities, these new ways to provide access to healthy food to people in very non-traditional places such as hospitals, places that you wouldn't think of getting access to healthy food.
The problem is right now that there's no funding from the police or from Hennepin County or from schools to support this. So over time, we need them to put this into their budget, so there is funding, because it's such a great idea, and they all think this, but it takes time. So we've got a window of opportunity, maybe necessity, where we're going to have to support this if we want to really grow it and improve it, and that's what we're going to need. That's a big challenge. I don't know if that's probably the biggest one, and it's certainly one that all of you can help with.